welcome to Bridging Barriers. My name is Susan Janzen. I'm so glad that you joined us today. And I've got a beautiful guest with me today, and her name is Rubina Dhanji. And I'm just so happy that you joined us on our Bridging Barriers, because this is where we dive into conversations that so many parents and caregivers need. And they say that after the fact and before the fact. But often they just don't know where to find the answers. So that's why we're here. So this is just the first of a series with Rubina, and the title of today's podcast is Feeling Lost After Diagnosis. So I'm joined with this lovely lady, and she's a registered occupational therapist and the founder of Abilities Occupational Therapy. So Rubina works with individuals across all ages and stages of life, not just children. But she's supporting everything from medical driving assessments and life care planning to ADHD coaching and feeding therapy, and also sensory-based support for children and families. So she's very diverse, does a lot of wonderful things. So what I love about Rubina's approach is that it's real, it's practical, and it's grounded in everyday life. So she helps families move beyond the overwhelm of diagnosis and into clear, manageable steps that actually you can use today at home. So in this series, we're going to break down some of the biggest challenges families face, from understanding behavior and sensory needs to bridging the gap between what's recommended in schools or hospitals and what actually works at home in real life. So if you've ever felt unsure, overwhelmed, or like you're trying to piece everything together on your own and that you're all alone in this conversation is for you. So Rubina, welcome, welcome, welcome. I'm so pleased that you're here today, and so nice to see you.
Thank you so much, Susan, for having me. It's a pleasure to be on your show.
Oh, thanks. So now tell me, I did a little bio about you, but I want you to just share about yourself a little bit, where you're located and where you're working, and why we want to talk about this episode today, why this is so important.
Sure. So my name is Rubina. I'm an occupational therapist. I have about 20 years of experience as an occupational therapist. I graduated from the Faculty of Rehabilitation Medicine at the U of A. In 2005. And I've worked in many different places throughout Alberta. So I worked in rural as well as urban Alberta. And I've worked in different, with different age groups. So when you are a therapist in rural Alberta, which I'm sure a lot of other therapists can relate to, you're kind of the jack of all trades. So you're a one person show. You're serving pediatrics all the way to geriatrics. So I think I get that's where that passion comes for providing services for all ages and stages of life. And I feel it comes naturally to me because it's something that I had to do very early on in my career. And then I actually moved to Edmonton and I worked at the Royal Alec for some time and then the University of Alberta Hospital. And then I moved to outpatient. So I worked at the K Edmonton Clinic. And then I decided to leave AHS and start working as a community therapist. So I joined the Canadian Back Institute and worked with them for some time. And then I left that position and started doing some subcontracting while I was doing my MBA in community economic development. So it was really nice to be able to have that flexibility of working, maybe 2 or 3 days a week while going to school. And then I started finding my own contracts. So I worked as an independent contractor. And probably about 3 years ago, we really decided to grow our business and we saw that there were needs that were not being filled. And there were really long wait times for the public health system, which I used to be a part of for many years. So we really wanted to develop services and programs to help families and support people who are, on a wait list or maybe they don't want to be on a wait list and they want to get some services earlier or faster.
Wow. So you've got a long history. You look so young. So there must be something must be right for you doing all this. This is great. So I've got one question for you. So what typically happens for families emotionally when they receive a diagnosis with their child? And personally, I've experienced this through my granddaughter. Kalea has had near SIDS when she was 8 weeks old. I remember it like she's 13 now, but I remember it like yesterday. So I remember those emotions and everything. So tell me what you find?
Well, I think by the time the family gets to me, they often feel frustrated and they feel lost.
Mhm.
They've been told that they need occupational therapy, but that's kind of all that they've retained.
Mm.
They don't necessarily know what they need it for. Sometimes some parents do, but sometimes I've had families who will reach out, who don't even know where to begin in getting a diagnosis. And that's typically I find it's families who are new to Canada who have difficulty navigating those resources.
Mm.
Um, and it could be a language barrier, it could be cultural barriers, it could be, technology. Maybe they don't have access to a computer, or if they did, they wouldn't know how to navigate to get to the right resources that they need. So, in the past, I've had families call where they don't really know where to begin, but they know that there's something wrong with their child
Mm.
or there's something going on with their child. They're not quite sure what. So I typically advise them to start with a pediatrician and to get a pediatrician, which is also difficult to do right now.
Yeah. And then they get a diagnosis from the pediatrician, and then they send them to you if that's what the pediatrician is. That what they're do they advise what they need exactly, or just who to talk to get the right answers?
Well, the pediatrician can then refer them on to specialty, like special
Yeah,
programs and
yeah.
stuff like that. Like, for example, at the Glenrose, they have programming. So I guess that's kind of the way that the referral system works. So the primary care physician would make a referral if they felt that additional testing is needed for a diagnosis or to confirm a diagnosis or suspect a diagnosis. And then the family would go through, typically they go to the Glenrose, I imagine, to get testing done and have a diagnosis for
Okay.
ASD. And then after that, they're given a report where it basically tells them kind of what to expect, why their child was diagnosed this way, what could be some underlying reasons, any additional tests that they should have done, recommendations for programming, but not, they're very broad recommendations as opposed to what do I do tomorrow morning?
Yeah, I think that's the problem sometimes for a lot of parents, because you
Yeah,
get this thing, you walk out of there going, oh my gosh, this is the diagnosis, and it's now what do I do? Like, yeah, but that's why where you come in is because you give them those step by steps, right? Like,
absolutely.
yeah.
Yeah, we do want to see the child, obviously. And when we're looking at the OT, like through an OT lens, we're not just looking at a diagnosis, but we're looking at how that diagnosis, which maybe they're not diagnosed yet, is impacting their daily functioning. So their ability to dress themselves, feed themselves, bathe themselves, groom themselves, participate in school, pay attention, sit, focus, socialize with kids their age. Um, all of the different occupations that would make up their full day, whatever they're having difficulty with is what the OT comes and starts working on with the child and the family. There are strategies for school as well that the
Yeah.
OT can provide.
Yeah.
And sometimes those strategies can only get you so far if the child isn't getting treatment as well outside of school. So I really do find that the children who are getting therapy outside of school, as well as getting the school strategies,
Yeah.
tend to do a little bit better with the school strategies because they are getting the therapy that they need.
Right. That's so good. I'm just curious, what's the most common diagnosis that you work with?
I get a I don't know why, but autism spectrum disorder I get a lot of referrals for children who
Yeah.
have ASD.
Yeah.
I do get children who have ADHD as well, but I do get a lot of children with ASD.
Mm. Mhm.
Um, and you can have a child who has autism spectrum disorder and also has ADHD, right?
For sure.
And these children have other issues with, like, for example, sensory regulation. So that's one of the things that we do in our clinic is sensory integration therapy.
Yeah.
Um, and we work. with them to kind of help them to regulate themselves better. And we can talk a little bit more about that
On
in
that,
our future episodes,
yes,
but
yes.
that's kind of what we do is we try to teach them the skills that they need to regulate themselves and kind of what works for them and what doesn't. And when we can regulate their vestibular system or what have you, then they function a lot better in school with the strategies that we provide, and even at home with the strategies that we provide.
Nice.
So yeah.
So there's lots of different children that you work with a range of with
Yeah.
disorders or with the diagnoses.
Yeah, because they could, like a child with ADHD or a child with ASD, they could both have issues with sensory regulation. So now we're not necessarily treating the diagnosis, but we're looking at how this symptom, if you will, like the sensory dysfunction or sensory dysregulation, how is that impacting this child's life? And then how do we work with that? How do we work with that particular, you know, difficulty that they are having that is impacting them. So if it's attention, then we work on strategies to kind of build attention, work on their executive skills, give them adaptive strategies, compensatory strategies. We try to do a little bit of rehab with them as well if they're responding to that.
Mm.
Um, but there's a lot of different things that we can implement. But yeah, I would say that ASD is the biggest diagnosis that I see, but the symptoms can go across diagnoses.
Wow. So when the parents first get the diagnosis, and that's when what we want to kind of like focus on today, just to say that like number one, you're not alone. Number one, other parents have gone through this, and when they feel lost and they don't even, I say that they don't even know the question to ask to get the answer to, like how you're kind of numb with the diagnosis and overwhelmed by it. And so what's the first thing? Now let's talk about the parents. Like what are the first things or the first steps the parents could take for themselves to help with this?
Like self-care for themselves.
Yeah, self-care or just kind of a mindset, like just something to appease them. Like I know with my experience, when Kalea was in the hospital at the Stollery for 5 weeks, she now has cerebral palsy and cortical vision impairment. Her eyes are fine, but she has occipital lobe damage, so she doesn't the processing to understand what she's seeing is not there. But at the time, I remember so clear. I'm just the grandma now, not the mom, so I can only speak from that heart in that place. But I mean, they said, oh, she'll be fed to, she won't walk, she won't talk, and she, has cerebral palsy, and she won't see. Like, so I mean, take a breath.
Yeah,
It's like,
that's
oh my Lord.
overwhelming.
So that's what I'm thinking about. I'm thinking about those parents now who they're probably remembering what it was at the time. But what mindset can we establish or to help them with to say, listen, this is what the facts are. Like this is how we can help.
Well, I think the big thing is uh, just giving direct treatment, first of all, is really important. Having a interdisciplinary team is really important as well in treatment. So having a team of healthcare professionals working together for the benefit of the child.
Mhm.
Um, when parents are given that diagnosis and it can be overwhelming, the way that we can help is really by trying to connect them to community resources, support groups, for example. The Glenrose does do a very good job of providing resources to parents.
Mhm.
But sometimes, and this is not their fault because
No.
I mean, if the website is obsolete or if it's changed, then parents are having to now navigate through multiple web pages and stuff to find that appropriate resource. So that can become a little bit of a challenge. But there are other resources that are mentioned by the Glenrose in their recommendations. So they're kind of blanket recommendations recommendations,
Mhm.
it seems like. For example, there's something called the 100-Day Toolkit, and it's on Autism Speaks website. And it's basically walks parents through the first 100 days after they've had received a diagnosis for their child. But it doesn't necessarily, it doesn't necessarily tell them about, um, you know, like you said, what can they do tomorrow,
Mhm. Well,
right?
that's yeah.
Um, it doesn't give them those types of strategies. It kind of just tells you, like it validates their emotions and what they're going through. And it gives a little bit of a roadmap, but I think what parents are looking for is something that's more practical, right? And
Right. Just to make them feel like they have control, like just that this is something that they can address and that they have the power to do that, you know.
And I think community occupational therapy does a good job of this because we can actually help them navigate a little bit and make sense of the situation. And they feel like there's a person
Hmm.
um, that is helping them as opposed to, you know, trying to do things virtually or going on Google and trying to, Google things and figure things out for yourself,
Don't chat GPT it. Oh my God.
chat GPTing it, and just all of those things, like almost trying to case manage. That's
Hmm.
what they're doing is case managing. So that's where we can come and help them a little bit and offload that by giving them some strategies and also giving them some direction to say, here's a support group for you that you can go to, and actually showing them how to navigate that resource as opposed to just giving it to them and saying,
Yeah.
here's a piece of paper,
Yeah.
um, follow the instructions on there, because it's difficult for parents, especially when they're dealing with grief and guilt and all of these things that probably come with the diagnosis, right?
Mhm. Right. Just that support that you get from peers too. That's why we established our Janssen Consulting Group because we wanted to be a hub for all of those agencies. And so when you come to our website, we can say, if you have that question, talk to this person. You know, that's why I love doing podcasts with the professionals too, because then we get to know and like you, and then we're feeling really comfortable to recommend you to go, you know, for those people to go see you too as well. And
Yeah,
that's in all categories, not just OT, but you know, in the other categories as well. So we're so glad
absolutely.
that you're there for these parents. Yeah.
Well, I was actually looking at the wait times for the support groups, and they're not terrible. It's about a month wait
Yeah.
time, is the earliest appointment that you can get, which is at the Glenrose. And this is the other thing, is that there are community resources out there that can provide that level of support and structure, but they may be private, or they may be nonprofit organizations, but we don't really know too much about them because um, we're so dependent on the public healthcare system for everything. And that's just how it's always been traditionally, right? In Canada, we've been very reliant and it has served us well, but it's become overburdened. And I feel that the resources that are shared, that are given to families after they've been given a diagnosis by a healthcare authority, they tend to only list services or supports that are kind of public health, not necessarily private resources that are available, because there's kind of this public-private, we don't, the two shall not mix sort of thing, right? But I feel that we do kind of a disservice when we do that because when you give families alternatives, it can go from waiting for 1 month to be supported in a support group to maybe
Right.
having to wait a week. Um, and I think families should be given those options, and that they deserve, that we should kind of respect that and respect their intelligence, that they should be given the choice to make that
Mhm.
decision. Because if they do choose to find a private provider, because they want the services sooner,
Mhm.
that frees up the wait list for people who can't afford it.
Right. Right.
So I think it's really a win-win. And then that 1 month waiting list to have a support group through public health might be, a 2 week waiting list instead.
Right.
Um, we don't know, right?
Right.
Um, but I think that's really important, is making sure that we're trying to get those resources and supports out to parents sooner so that they don't have to wait a month. Like a month can feel like a year
Oh
when
gosh,
you have
yeah.
a patch with a disability.
Especially when you're home with that child, that your kiddo and your whole family, and trying to cope with all those things.
Yeah, and we do vehicle modification assessments. So we have worked with people who have had spinal cord injuries or amputations and they need a modified vehicle or they need a way to drive from their wheelchair or get the wheelchair into the van. And how do you do that? And so we have a lot of experience with those kinds of things. So again, an occupational therapist, I would say, is a really great community resource
Oh, yeah.
if parents have any questions, because that's what we do. We try to rehab the person, and if we can't, we will modify the task or the environment so that the individual can complete that activity.
Okay.
Um, and sometimes I'll have or people who will say to me, let's just say they have a hand injury, and they're like, "Well, you know, I can't." Hold a watermelon and cut it with the other hand. There are devices that you can get that will actually hold the watermelon for you while you cut it with one
Yeah.
hand, right? And there's modified knives that you can get that make it easy to cut with one hand, or you can get robotic things. And people don't realize that these equipment items exist or how to utilize them. And so an OT is really good for that because that's kind of what we do. We work with
A lot of
equipment, try
a
to
lot of
figure out.
practical
Yeah.
tips too, which I love. Like a lot of practical, specific things where you can point them in the right direction.
Yeah, absolutely. Absolutely.
That's awesome. Well, anything else that you want to share with us that you really want the parents to know, and how to get in touch with you, and those kind of things that are really important, because I want them to be on the guard here. Now they can pick up the phone.
Yeah, well, we at our clinic, what we specialize in is sensory integration therapy and feeding. So we do the SOS approach to feeding, and we will do a series on that for parents and providing some tips and strategies and kind of talking a little bit about some of the challenges that they might be facing and ways around that and why some of those challenges are happening. So we're shedding light on that. But yeah, in the meantime, if parents have any questions about our services or have any other questions, they're welcome to reach out to Abilities Occupational Therapy. Our website is myabilities.ca.
Mhm.
We have a phone number there
Yeah.
and a form that they can just put a question in, and we try to respond to the inquiries that we get within 24 hours.
Hmm. Awesome. And then that reminds me too, before we close, is that our next episodes are very specific. And do you have that off the top of your head, like the episodes and what we're covering?
Oh no, I don't.
Oh, no, meaning it's okay. Don't worry. I'll be posting it, and everyone just make sure you tune in, because we'll be very specific about because we have 6 episodes, and we're just really excited about that. And Rubina, to have you back to do
I'm
each of
so
those is
excited.
going to be awesome, awesome, awesome.
Well,
So,
thank
but don't you worry, everybody. I will post that for you. I will make you, hunt and peck for that. So, everyone, thank you, Rubina, especially. You're such a beautiful person, and I just love what you're doing. And
you.
thank you so much for taking the time to be with us today. And thank you everybody for joining Bridging Barriers today. We're here for you, and you're not alone for sure. These are conversations that truly matter, and we know that because we've been there. This is lived experience for my daughter and I. So if today's episode spoke with you, please let us know. And remember, you're not alone, and there's a whole community of parents and caregivers and professionals who understand the journey that you are on and would love for you to be part of this journey with us. So, and if this episode resonated with you, just please share it with someone that needs to hear it, okay? And until next time, keep showing up and keep learning and keep bridging those barriers one step at a time. So we just want to thank you so much for joining us. And Rubina, thank you so much for being here. And yeah, tune in. We'll be seeing Rubina lots more. We've got some amazing episodes coming up. So we'll see her again. So thank you so much, everybody. And great to thank you for tuning in today.